All right, welcome back. We are jumping into a deep dive today, unlike any other. This one is built specifically for you, the listener, to help supercharge your revision. Our mission today as well, to take a detailed set of revision notes you've shared with us on DNA viruses, exactly the kind of material you'd be poring over for exams like the MSRA and, cut through the noise. We want to extract the absolute highest yield nuggets, connect the dots, and make this information genuinely sticky and useful for recall under pressure.
That's right. We have a really focused set of notes here covering the essential points about DNA viruses. But instead of just reading through them, we're going to discuss the concepts, highlight the crucial distinctions, and hopefully make those facts much easier to remember when it counts.
Okay, perfect. Let's unpack this then. Let's start with the absolute fundamental question. What exactly is a DNA virus, like at its core?
Simply put, a DNA virus is, a virus that uses DNA as its genetic material. That's really their defining characteristic. They're remarkably diverse, infecting pretty much everything from bacteria to plants. And yes, crucially for our purposes, they infect humans, causing a huge range of diseases. When we look at their structure, the vast majority we encounter in humans have double-stranded DNA genomes. That's key. But there's one really important exception we need to flag right up front for memory. We'll get to that. These viruses are grouped into families, and understanding these families is essential because each one tends to cause distinct clinical conditions.
Okay, right. And this is where it gets really interesting. Looking at the families in these notes, you start to see the patterns. You've got the herpesviruses, double-stranded linear DNA, and notably, they are enveloped. These are massive in human health. Think HSV, VZV, CMV, EBV, behind things like cold sores, chickenpox, the common stuff.
Exactly. Big players.
Then there's Hepadnavirus. Now, this one's a bit unique, structurally double-stranded but circular DNA, right? And it's also enveloped. Circular and enveloped.
And the big one here is hepatitis B virus, HBV.
Correct.
Then the adenoviruses. Double-stranded, linear, but importantly, they are naked, no envelope.
Naked, yes.
Yeah.
That's a key difference.
And these cause things like the common cold, conjunctivitis, stuff like that.
Common infections, yeah.
Now, remember that exception you mentioned?
Yeah.
That's Parvovirus. It's the only one in this key list that has single-stranded linear DNA. It's also naked.
Single-stranded, that's your high-yield exception right there. Parvovirus B19 causes fifth disease, that slap cheek rash.
Right, slap cheek. Got it. Moving on, papillomavirus. Double-stranded, circular, and naked.
Another naked one.
This includes HPV, which is, famously linked to cancers, particularly cervical cancer.
A very important link to remember.
And poxviruses. These are large, double-stranded, linear, and they are enveloped.
Enveloped again, like herpes and hepadna.
Examples. Well, the eradicated smallpox virus and the still common molluscum contagiosum.
Molluscum. You see that a lot. And finally, polyomavirus.
Yeah.
Double-stranded, circular, and naked.
Circular and naked like papilloma.
JC virus is a key example here, known for causing serious brain infections, PML, in immunocompromised patients.
A nasty one in the wrong context, yes.
And thankfully, there's a brilliant mnemonic right there in the notes to help remember the key families. HAPPHIP.
Yeah.
That's Hepadnavirus, herpesviruses, Adenovirus, Poxvirus, Parvovirus, papillomavirus, polyomavirus. Super helpful for just sorting them out initially.
It really is. And to really lock it in for revision, out of that entire HAPP list, Parvovirus is your odd one out. Single-stranded DNA.
Right.
The rest, double-stranded. Also worth clocking which ones are enveloped. Herpes, hepadna, pox.
Okay.
Because that tells you a lot about how hardy they are outside the body.
Yeah.
How they might be transmitted or inactivated. Naked viruses tend to be tougher.
That makes sense. So knowing their structure, enveloped or naked, gives us clues. But how do people actually get these viruses? What are the main risk factors, the transmission routes we need to be aware of?
Exactly. And the way they spread often links back to that structure we just talked about. Transmission routes are varied. Direct close contact is very common for many.
Okay.
Sexual activity for some, like HPV and HSV, is obviously a major route. Respiratory droplets for others, like adenovirus.
Right, like the common cold spread.
Precisely. And sometimes even contact with contaminated surfaces, especially for those more resilient naked viruses. They can hang around longer.
Okay. And beyond the virus itself, what about the person? Host factors?
Yes, certain host factors significantly increase risk. Immunodeficiency is a huge one right across the board. Makes people much more vulnerable.
Makes sense.
And crucially, lack of vaccination, where a vaccine exists, like for HBV or HPV, that's a key preventable risk factor.
Definitely. And the notes also mention behavioral factors playing a role.
Yes, things like unprotected sex or sharing needles, particularly relevant for viruses like HBV or potentially HSV.
So this practical stuff helps make sense of, who gets what and how to advise patients on prevention.
Absolutely. It connects the dots between the virus and the real world.
Okay, so the virus has gotten into the body. What happens next? Walk us through the basic pathophysiology. What do these viruses actually do once they're inside our cells?
Right. So once inside a host cell, DNA viruses typically make their way to the nucleus. That's where our DNA is.
Yeah.
They then effectively take over the cell's machinery, its enzymes, its replication processes, and use it to make more copies of themselves. They basically hijack the cell's own factory.
Okay, they turn the cell into a virus factory.
Pretty much. And a really critical concept for many of these, particularly the herpesviruses and Hepadnavirus, is their ability to establish latency.
Latency.
Yeah.
What does that mean exactly?
It means the viral genome, the DNA, can just sit there within the host cell for long periods, often dormant, without causing active infection or symptoms.
So the virus isn't gone, it's just hiding,
Yeah.
lying low.
Precisely. It's persistent. And this is absolutely key because things like stress, other illnesses, or a weakened immune system can trigger reactivation. When that happens, the virus starts replicating again, leading to symptoms, shedding new virus particles, and the potential for transmission all over again.
So that explains things like recurrent cold sores with herpes or getting shingles years after you had chickenpox from VZV.
Exactly that. VZV is a classic example of latency and reactivation. And this ability to go latent is fundamental to understanding the chronic nature of many of these infections and their long-term complications.
Okay.
It's important to remember, though, that the specific ways they cause disease, the actual pathophysiology, varies dramatically depending on which virus it is and which specific tissues they like to target.
That makes sense. So when someone comes in with symptoms, maybe it's a rash, a fever, or something else, how do doctors figure out if it's one of these DNA viruses? And what else might be on their list? The differential diagnosis.
Good question. Diagnosis usually starts with the clinical picture, looking at the symptoms, the patient's history, but it absolutely relies on laboratory testing for confirmation. You can't usually tell just by looking. The differential diagnosis is broad because, honestly, the symptoms can be really nonspecific sometimes. You're always going to consider other potential infections. So other viral infections, RNA viruses, perhaps bacterial infections, and sometimes even fungal infections, depending on the presentation and the patient.
And I guess you have to think beyond infections, too.
Absolutely. Don't forget non-infectious conditions. Sometimes symptoms like a rash or swollen glands could be an allergy, an autoimmune issue, something else entirely. So those also need to be in the mix, considered and ruled out.
Okay. And what about the bigger picture? Epidemiology. How common are these things?
Yeah, looking at the bigger picture, epidemiologically, the prevalence of these viruses varies quite a bit. Even within a place like the UK, it's not uniform. Some, like herpes simplex virus HSV1 and 2 and human papillomavirus HPV, are incredibly common. Really high prevalence rates in the general population. Many people have been exposed.
Wow. Okay. So lots of people walking around with these potentially latent.
Potentially, yes. And that distribution, who gets them and where, is influenced by various factors, things like vaccination rates.
Right, HPV vaccine effect.
Exactly. Population density matters, how close people live together, and even local healthcare practices like access to screening, testing, or prevention programs. It all plays a role.
Okay, let's get really practical then. What do these infections actually look like in a person? What are the common clinical presentations we'd see?
Yeah, as we've kind of touched on, the presentation is incredibly diverse. It really depends on the specific virus and which organs or tissues it's affecting. Symptoms can be anywhere from very mild, maybe even asymptomatic, the person doesn't even know they have it, right up to severe and potentially life-threatening infections.
Big range.
Huge range. But there are common themes depending on the virus family. Frequent presentations include various skin lesions, think rashes, vesicles, warts.
Okay.
Genital warts are classic for HPV. Painful oral or genital ulcers often point towards HSV. Respiratory issues like cold symptoms or pneumonia can be adenovirus. General symptoms like fever and rash are common with many, like Parvovirus B19, and for some, like JC virus reactivating or VZV causing encephalitis, you can even get serious neurological symptoms.
And it's crucial, as you said, to remember that point about long-term complications, especially in immunocompromised individuals. That links back to latency and really affects the overall outlook, doesn't it?
Absolutely. It's not always just about the acute illness.
So how do the labs definitively confirm it's one of these DNA viruses? What are the key investigations, the tests they use?
Right. The lab is crucial. The gold standard is specific laboratory testing using clinical samples. This could be blood, swabs taken from lesions, or the back of the throat, urine, CSF, or even tissue biopsies, depending on where they suspect the infection is active.
Okay, what kind of tests?
Several techniques are commonly used. PCR polymerase chain reaction is incredibly powerful. It's super sensitive for detecting the actual viral DNA itself.
The genetic material.
Exactly. Viral culture, where they try to grow the virus in the lab, can sometimes be done, but it's often slower and less common for routine diagnosis these days compared to PCR.
Right.
Serology is useful too. That looks for antibodies against the virus in the patient's blood. It tells you about the immune response or past exposure, though maybe not active infection right now.
IgM versus IgG and all that.
Precisely. And sometimes antigen tests are available, which detect specific viral proteins rather than the DNA or the antibody response.
So these tests aren't just saying, yes, it's a virus.
Yeah.
They're identifying which specific virus, sometimes telling you how much virus is the viral load.
Yes, viral load can be important for monitoring treatment.
And giving clues about the patient's immune system response.
Mm-hmm.
All vital for diagnosis and deciding on management.
Exactly. It gives you the full picture.
Okay, so once a DNA virus infection is diagnosed, how do we manage it? What does treatment generally look like?
Again, management is highly dependent on the specific virus, how severe the illness is, and very importantly, the patient's immune status. Is this a healthy person or someone immunocompromised?
Makes sense.
For many of these, antiviral medications are the cornerstone of treatment. Drugs exist that specifically target viral replication.
How do they work?
They basically interfere with the virus's ability to copy itself. This helps to reduce the amount of virus, ease symptoms, shorten the illness duration, and importantly, prevent complications. A cyclover for herpes is a classic example.
Right.
But prevention is also absolutely key here. Vaccination plays a crucial role where we have vaccines available. Vaccines for HPV and hepatitis B virus are prime examples, really effective public health tools that prevent infection and the serious long-term issues they can cause, like cancer.
So antivirals for treatment, vaccines for prevention. What else?
And then there's just supportive care. Often, that's all that's needed for milder infections. Things like rest, staying hydrated, managing symptoms like fever or pain with over-the-counter meds. Of course, severe infections often require more specialized care, maybe even hospitalization for IV fluids or more intensive monitoring and treatment.
Okay. And finally, wrapping up, what's the typical prognosis, the likely outcome, and what are the potential complications people need to be aware of?
The outcome, the prognosis, it varies hugely, just like everything else with these viruses. Some infections are acute, relatively mild, and resolve completely, especially in healthy people, maybe just with supportive care. Others, as we've discussed, especially those that establish latency, can become chronic, persisting in the body for years, maybe flaring up now and then.
Right, the latency factor again.
Exactly. And complications can range widely, too. Organ damage is possible, particularly with viruses like CMV affecting transplant patients, or HBV leading to liver cirrhosis. Persistent viral shedding, even without symptoms, can continue the risk of transmission to others. Secondary bacterial infections can sometimes complicate things, like getting a bacterial skin infection on top of herpes lesions. And significantly, as we mentioned, some DNA viruses, HPV and HBV being the big ones, but also EBV linked to some lymphomas, are directly linked to the development of certain cancers later in life.
That's a really serious potential outcome.
It is. And what's fascinating here is that the prognosis isn't just about the virus itself. It's a really complex picture. It's influenced by factors like how early the infection was diagnosed, how quickly and effectively treatment was started, the underlying strength of the patient's immune system, and any other health conditions they might have.
So it really underscores that treating the whole patient is just as important as targeting the specific virus.
Absolutely. It's a complex interplay.
So let's try and pull this all together. We've taken these detailed revision notes on DNA viruses and really tried to, make them sing for you, make them more memorable. We've covered the fundamentals, DNA as the core genetic material, the key families, remember, HAPPIP, who's enveloped and who's naked, that crucial single-stranded exception, Parvovirus.
Mm-hmm. We've connected that structure enveloped versus naked to how they spread, talk through their sneaky ability to go latent and then reactivate later.
Yeah.
How we figure out it's actually them through specific lab testing, and how we approach managing these incredibly varied infections and thinking about their potential long-term impacts.
Hopefully this deep dive gives you a much clearer, more interconnected understanding of this whole group of viruses. making those facts, much easier to recall when you're faced with those MSRA questions or clinical scenarios. Think about HAPPHIP, think about enveloped versus naked, think about latency. Those are key concepts.
And actually, thinking about enveloped versus naked raises an interesting point to leave you with. If enveloped viruses are generally more fragile outside the body than naked ones, what does that imply about the effectiveness of things like standard disinfectants or alcohol-based hand sanitizers against the different DNA virus families? Are they equally effective against adenovirus as they are against herpes virus?
Ooh, good question. Something to think about as you continue your revision, connecting structure to practical prevention.
Exactly. It helps solidify that link between basic science and clinical practice.
Definitely. For more resources to help you prepare for the MSRA, be sure to check out PassTheMSRA.com.
And also freemsra.com for loads of free questions and resources.
Great stuff. Thanks for joining us for this deep dive into DNA viruses. Keep learning.